Hello guys, our today's topic is introduction to the orthodontics. First of all, you should know what is orthodontics. Orthodontics, it is a branch of dentistry that deals with the three things. The first is the diagnosis, second is the prevention, and third is the treatment. So the orthodontics, it is a branch of dentistry that focus on the diagnosis, prevention, and the treatment part of the misaligned teeth and the jaws. So, the main goal of orthodontic treatment is to improve the appearance, function, and overall health of the teeth and the jaw. Now, the orthodontic treatment can be classified into several types based on the purpose and the nature of the treatment. So, the common type of the orthodontic treatment is number one is the preventive orthodontics. So, here the treatment is aimed at preventing the development of dental and orthodontic problems before they occur. So, the aim is to prevent the development of dental and orthodontic problem before they occur. Example can be space maintainer or is the habit breaking appliance. The second is the interceptive. The second is the interceptive orthodontics. So this type of treatment it is designed to intercept or correct the developing orthodontic problem before they become more severe. So it is done in young children to address the issues like the crossbite, overbite, and crowding. The third is the corrective orthodontics. So this type of treatment it is aimed at correcting the existing dental and ortho problems. So braces, aligners, and other appliances they are used to move the teeth into proper position and improve the overall appearance and function of the teeth and the jaw. The fourth type is the surgical orthodontics. So here that involves the surgical procedure to correct the more severe orthodontic problems like if the jaw they are misaligned we correct them or skeleton malformation by the surgical approach. So these are the four types that you should know. The next important thing is what is Jackson triad. So according to the Jackson, uh, three concepts they are important in considering the ortho treatment and they have an important role in the overall success and satisfaction of the treatment. The first is the functional efficiency. So that refers to the ability of the teeth, jaws, and the surrounding structure to function properly and efficiently. So the ortho treatment, it can improve the functional efficiency by correcting the issue like the misaligned teeth and the jaw that can lead uh, to problems with the speech, chewing, and overall health. The second is the structural balance. So that refers to the balance and harmony between the teeth, jaws, and surrounding facial structures. The third comes the aesthetic harmony. So that refers to the overall appearance and aesthetic of the smile and the face. So ortho treatment, it can improve the aesthetic harmony by correcting the problems like crowding, spacing, malocclusion that can lead to more attractive smile and a confident smile. More attractive and a confident smile. Now, important things that you have to remember for the exam point of view is who is the father of the modern dentistry? Who is the father of the modern orthodontics? Well, Pierre Fauchard, who was a French dentist, is the father of the orthodontics. He wrote a book that is known as Surgeon Dentist that include a section of irregularities of teeth and their correction. Now, who coined the term orthodontics? It was coined by Lee Fallon. The term orthodontics was coined by Lee Fallon. Remember, in the 19th century, an English dentist named Engel, he is credited with the development of first scientific system of the orthodontic system. Also remember the Pierre Fauchard, he introduced the appliance name as Bandlet, who is known as the considered as the father of modern orthodontics. So it was a thin metal strap that was placed around the teeth to help move them into the correct position. Remember, in 1887, the Engel, it was Engel who introduced the concept of occlusion. So who introduced the concept of occlusion? It was Engel. Who gave the 6 keys of occlusion? It was given by Andrew. Now, few important points that you have to remember for your exam is: number 1, who is the father of modern dentistry? It is Pierre Fauchard. John Hunter, he was first to describe the growth of jaws on sound scientific investigation. Joseph Fox, he was first to classify the malocclusion. Kingsley is father of orthodontics. He was first to introduce the occipital traction and use of obturator in cleft lip and palate patient. Guilford coined the term malocclusion. Uh, William E. McGill, he was first to cement the bands. Baker introduced the concept of intermaxillary anchorage. Edward Engel is father of the modern orthodontics. He gave the concept of key of malocclusion, gave the classification of malocclusion, gave termed the E-arch, pin and tube, ribbon arch, standard edge wise appliance was introduced by H. Engel. Beck introduced the concept of light force differential orthodontic system. Andrews introduced pre-adjusted edgewise appliance. Kurz introduced the lingual orthodontic system. Kessling introduced tip edge appliance. Bennett suggested the term dentofacial orthopedics. So Engel started the first school for specialization in dentistry. In 1985, the title of the American Journal of Orthodontics it was revised and changed to American Journal of Orthodontics and Dentofacial Orthopedics.